to the SLTV. This video was created from a full-length article on our health website. I will drop the link to the article in the description box. After watching, please make sure you like, share, and subscribe. And please do not forget to come back for more. See you soon.
Navigating a pregnancy can feel like a huge, exciting adventure, right? But it can also feel a little unknown. Today, we're going to pull back the curtain on one of the most important parts of this journey, all those essential tests. Think of this as your guided tour, a roadmap to a healthy, happy pregnancy.
You know, this quote really just hits the nail on the head. Pregnancy is this incredible mix of pure joy, total wonder, and yeah, a little bit of worry. It's completely natural to have questions, and that's exactly where prenatal testing comes in. It's there to help quiet those worries and give you clear answers right when you need them most.
So let's reframe how we think about these tests. They aren't hurdles you have to clear. No way. They're actually on your team. They're a huge part of your support system, giving you and your healthcare provider the information you both need to make the absolute best decisions for you and your baby.
Okay, so what's the big why behind all of this? It really boils down to two simple words: early detection. The whole point is to spot any potential bumps in the road as early as possible. That way, your medical team can get ahead of the game and be proactive, which is exactly what you want. And what's really amazing is that these tests are kind of doing double duty. For your baby, they're checking on everything: growth, position, and screening for specific conditions. But they're also looking out for you. They make sure you're staying healthy enough to support this whole process, catching things like anemia or gestational diabetes before they turn into bigger issues.
All right, so we've got the why down. Now let's get into the what and the when, starting with the very first trimester. This is all about setting the foundation, getting that initial snapshot of health that we'll keep an eye on for the next 9 months.
So one of the first things you'll do is get some blood tests. Sounds pretty standard, but they check for some really important stuff. They'll figure out your blood type and something called the Rh factor, which is super important to make sure your blood and the baby's play nice together. They'll also screen for inherited conditions, check for common things like anemia, and look for any infections that might affect the baby, so treatment can start right away if it's needed.
And then comes the moment so many of us can't wait for, the first ultrasound. It's amazing, really. It just uses sound waves, totally safe, to create that very first picture of your baby. It's just an unbelievable peek at this new little person.
So this first scan, it's all about getting the basics right. First, it confirms everything is where it should be, developing safely. It'll also help nail down a more accurate due date. And of course, it answers that big, exciting question: is it one baby or maybe more?
Okay, moving on to the second trimester. The groundwork has been laid, and now we get to take a much closer look at how your baby is developing. This is when the picture really starts to come into focus.
The main event of the second trimester is definitely the anatomy scan. Seriously, it's like a complete head-to-toe inspection for your baby. The technician looks at every single organ, measures growth, checks on the placenta, the whole shebang. And yep, if you want to know, this is usually when you can find out if you're having a boy or a girl.
So you might be thinking, okay, why the sudden focus on blood sugar? Well, it all comes down to those powerful pregnancy hormones.
It's pretty wild. Those same hormones that are doing all this amazing work can also make it a little tougher for your body to handle sugar. This can lead to something called gestational diabetes. That's why they do the glucose screening test. It's a really simple way to check for it, and if they catch it, it's totally manageable and keeps both of you safe and healthy.
And just like that, you're on the home stretch, the third trimester. It's the final countdown. The tests from here on out are all about one thing: getting ready for a smooth and safe delivery.
Okay, one really important test you'll have is for something called Group B strep, or GBS. It's a super common bacteria that's totally harmless to you but could cause problems for the baby during birth. All it takes is a simple swab. If you have it, they just give you some antibiotics during labor. Easy. It's a simple but powerful way to keep your baby protected.
As you get closer to the big day, there are a few last checks. They might repeat a blood test to check for anemia again, you'll keep doing urine tests, and you might even get one last ultrasound, just to make sure the baby is head down and ready for their grand entrance. Okay, let's talk about getting the results. This can be the most stressful part, right? Waiting for that call or that update. So let's break down what the results actually mean, and this is important, why it's key not to jump to conclusions.
A normal result? Awesome! That's a green light, basically saying everything looks great. But what if a result comes back abnormal? Okay,
Deep breath. It is so important to remember this. That does not mean something is wrong. It's not a diagnosis. It's more like a yellow light. It just means, hey, let's take a closer look here. It's a call for more information, not a cause for alarm.
So as we wrap this up, I really want you to think of these tests as partners on your journey. They're not just medical procedures. They are powerful tools that give you and your doctors the knowledge you need to make sure your baby gets the safest, healthiest start possible.
Look, knowing what these tests are all about empowers you. It makes you an active player in your own pregnancy story. So I'll leave you with this. What's the first question you're going to ask at your next appointment? Because this is your journey, and your questions absolutely matter. Thanks for joining me on this explainer.
Please subscribe.